Franz. I'm a child psychiatrist at Duke University Medical Center and the Duke Center for Autism and Brain Development. And I'm here with Dr. Scott Kollins for our third installment of COVID tips. If you are interested in our other episodes, we have them archived on our center website pages, but they're also available on our Facebook pages. And Scott, I don't know if you want to introduce yourself.
Sure, thanks, Lauren. Hi, everybody. My name is Scott Kollins. I'm a clinical psychologist and professor in the Department of Psychiatry at the Duke School of Medicine. I'm also the director of the Duke ADHD program and excited to be here along with Lauren to keep our dialogue going about tips and strategies to help coping with children on the spectrum and with ADHD during these interesting and difficult times. So today's topic is a really important one, and I'm going to hand it back over to Lauren to get us started.
Thank you, Scott. So, you know, as we continue to live in a pandemic world, we thought a good topic for our third installment would be around sleep. So sleep both for adults, but sleep for kids as well, because we know that if somebody in the house isn't sleeping, you know, there's a good chance that the sleep quality of the family is being impacted. So looking at this from an adult and a child perspective is something we were interested in doing. So we have had huge disruptions in our lives as a result of COVID. And this has invariably impacted our stress level, so both individually, but also as a family unit. And it's also impacted mood, anxiety, and invariably our sleep. And there are studies coming out now that actually point to a rise in insomnia in the context of COVID. And this is honestly not surprising because of, you know, the stress that folks are facing right now. Many of us are in what I would call survival mode, right? So we are juggling multiple responsibilities that could involve trying to keep down a full-time job while full-time, you know, homeschooling our children. You know, many folks have lost their employment. Many folks are suffering sort of personal grief as a result of losing family and friends as a result of the pandemic. So invariably, this can increase our stress levels, which results in poor sleep. And poor sleep can, you know, impact, we can result in poor concentration, increased sleep, low frustration tolerance, which can result in increased irritability, which all feeds back into, you know, more challenges sleeping. So we could get stuck in this vicious cycle. But the good news is that there are things that you could do to prevent sleep challenges if you are not having them, if you're a lucky person that is not having them, or the things that you could do to try to address it if you are. And, you know, while a lot is not under our control right now, for the most part, we are in control of our personal habits. So as we move into the winter months, some ideas could be, you know, trying to get out in the morning, get those early sun rays. And this is becoming more and more important as daylight hours are getting shorter as we go into winter. Starting your day outside, trying to get some of that bright light, even trying to do some exercise outside in the morning if at all possible. All of these things can help, you know, regulate your internal clock, which is also called your circadian rhythm. You know, routines can also help regulate your circadian rhythm, which is your natural internal process that helps regulate your wake-sleep cycle. Other things that would sort of fall in this general bucket of sleep hygiene would be trying to do things that keep the sleep bed connection tight, and I'll talk a bit more about that in a few minutes. And then also thinking about whether there are things that you can do to limit your artificial light exposure. So, you know, from personal experience, instead of in-person meetings now, I'm spending a lot of time looking at the computer during the day, getting that artificial light exposure. But are there things that we can do to limit it in other ways? So for example, maybe cutting back on our social media exposure, which is often what we're looking at on our phones and our screens. Or even, you know, can we cut down on our exposure to to reading, and being exposed to news media? Are there things that we can do to cut down on the non-essential things right now that expose us to artificial light? We sort of warn against long sleeps during the day because that can disrupt your circadian rhythm even more. I've spoken about exercising, but something also to think about is limiting exposure to certain substances that can actually interfere with your sleep. Particularly 4 to 6 hours before you go to bed, limiting exposure to things like caffeine or alcohol or nicotine. And then thinking about whether there are, relaxing activities that you can engage in before you go to bed. And limiting, maybe stimulating activities in your bed, like watching TV or watching computers and being around bright light. So when could it be time to think about not just good sleep hygiene, but actually reaching out for more help that's targeted at insomnia? So I've included the DSM-5 criteria for insomnia on this slide. And insomnia is important because it's actually really under-recognized and it's under-treated, and it can have physical and mental health impacts. It can impact your cardiovascular health, and it can also impact things like, either cause or exacerbate psychiatric conditions like depression or anxiety. So how DSM-5 defines insomnia is sort of dissatisfaction with the quality and quantity of your sleep. And this is associated with difficulty falling asleep, staying asleep, or early morning awakening. And these types of sleep challenges are actually impacting your functioning. They're occurring with a certain frequency and for a certain amount of time. And importantly, they're also occurring when you have enough opportunity to actually be getting enough sleep, but it's not happening. Cognitive behavioral therapy for insomnia, or CBTI, is what we consider first-line treatment for chronic insomnia. And what this is a multi-component treatment which really aims to identify and targets the thoughts and behaviors that could lead to, chronic disrupted sleep, insomnia. So there is a good evidence base for cognitive behavioral therapy for insomnia, which actually shows that it can increase the duration, which is the amount of time you sleep, but that also these effects can be sustained over time. And the good news is that now there are multiple app-based options available for CBTI, and so you can do it on your own time, on your own schedule. But if that's not the way that you would like to receive treatment, you could always reach out to your primary care provider to get more of a sort of a personalized in-person approach, which now honestly would probably be done through telehealth. Which can also sort of increase the flexibility of these types of treatment approaches. So the first step of CBTI, is often psychoeducation, which is providing somebody, sort of educating folks around what insomnia is and what sleep is. Because part of the CBTI approach can feel a little bit counterintuitive in the beginning. And so telling people why these sort of recommendations are being made can help get people on board. Some, for the next step could be working to identify the underlying causes of insomnia. And these may involve you actually keeping a sleep journal or a diary to help you identify behaviors or thoughts or sort of chronic stresses that are contributing to your insomnia. Another component of this approach could be what we call stimulus control, which helps you relearn those associations between the sleep environment and rapid sleep onset, and associate the bed with sleeping and sort of limit stimulating behaviors that may be occurring and interrupting that sort of connection between the bed and sleep. And then sleep hygiene, which I've already spoken a bit about, which targets sort of the behavioral habits that can negatively impact sleep. And then something called sleep restriction, which may be, a difficult component of cognitive behavioral therapy for insomnia for some folks, but it is a significant and effective component of this approach. And what this involves is actually controlling the time that is spent in bed based on the individual person's, what we call sort of sleep efficacy. And this will help sort of restore and reinforce that bed-sleep connection. So that's just a bit of information about CBTI, and we'll include some resources on our website if you're interested in finding out more about it. And now I'm going to hand over to Scott to talk more about sleep in children.
Thanks, Lauren. The easy part of my presentation is because Lauren has already introduced everything, and almost everything that applies to adult sleep applies to children's sleep. I'm going to hit some highlights and talk a little bit about how we think about children's sleep and identifying problems with children's sleep. But in large part, what Lauren said sort of generalizes a little bit. I do want to give full credit for most of the content here to my colleague, Dr. Jessica Lunsford Avery, who's our resident sleep expert in the Duke ADHD program. So first off, just like Lauren said, in adults, sleep problems in kids are common, and they can be really distressing. I mean, from the time that a newborn comes home, sleep in children can be one of the most kind of stressful parts of a parent's routine. And problems can include a lot of different difficulties. They could include falling asleep. They could include staying asleep through the night. They could also include difficulty getting out of bed in the morning, as well as just a lot of problems leading up to bedtime. And as I mentioned, these are prevalent in kids and adolescents. And we know that sleep is associated with a lot of negative outcomes, including their cognitive functioning, their emotional functioning, how they do in school, how they do with their peers, and how it relates to risky behaviors and other health behaviors. And we also know that sleep disorders and sleep difficulties occur at higher rates in kids that have other kinds of problems, in particular ADHD and autism, like we're talking about here. And a really important thing to keep in mind here is that the contributors to sleep patterns in general, and also when problems emerge, there's really two big factors that influence sleep in kids and adults. There's who you are and your biology, and there's the environment. People are programmed differently from a genetic standpoint in terms of what their circadian patterns might be like. There are some people like myself who are what we call morning larks. So these are folks whose circadian rhythms tend towards early morning awakening and sort of going to bed earlier. And then there's our night owls. And those are people whose circadian rhythms sort of naturally tend later in the day. That's more biological, although those things can be influenced by environment. But really importantly to think about how we address some of these problems, is a big contributor to sleep patterns is environmental. So things like Lauren mentioned, exposure to light and screens, stressors, irregular sleep and wake timing, as well as behaviors like what we eat and drink, taking naps at unexpected times, or you know, when that aren't part of the normal routine. And these are really the areas where, as parents, we can think about intervening when problems do emerge. So good sleep hygiene supports children's sleep. This is really important to remember. It is admittedly much easier said and presented in a short video than actually done on a day-over-day, sort of in a day-over-day manner. But it's really important to keep in mind that these things really do make a difference. And things like consistent bedtime and wake time, this by itself has been shown to have a huge impact on some of the negative and positive effects of sleep, is something we call sleep regularity. So trying to make sure that sleep and wake are happening at the same time. And this even means on the weekend. And I know that's difficult because routines can change and things like that on the weekend, but to the extent possible, trying to keep those bedtimes and wake times for kids consistent over time is important. That's also it's somewhat dependent on your child's developmental level too, because a teenager, that might be a little bit more difficult than it might be for an elementary school student. Nap times are okay for young children, but they shouldn't be. But they should be scheduled and they should be consistent. Also, creating this wind down routine where, as Lauren said, you're thinking even several hours before bedtime about what's coming up and being mindful of what a child might be eating or drinking, what kinds of activities that they might be engaged in, and really importantly, in today's sort of constant information access type of society we live in, limiting screens, that can really play a big role, and there's a lot of data showing that influences sleep patterns. So all of these things, as I mentioned, think about considering when your child is exposed to what kinds of light throughout the day, really eliminating those screens at nighttime, promoting physical activity during the day, but not too close to bedtime. And then also an environment even that's comfortable, quiet, dark to the extent possible. That's not always that's not always possible, but to strive for that is important. Know when these difficulties falling and staying asleep are significant. And for some kids, sleep hygiene is not going to be sufficient. In the interest of time, I'm not going to go through a lot of the things. Lauren talked a little bit about the components of CBT for insomnia. We have CBT for insomnia for kids, and there's good evidence that that works. And there's also other more simple, straightforward tips and strategies that you can find on our website. We'll post resources for some of this. But just remember, getting good sleep is really important. It really sets a good foundation for how we're functioning throughout the day, how we're able to cope. You know, one of the things that I always find personally is after not getting a good night's sleep, I notice that in terms of my, not just being a little sleepy, but my frustration tolerance, my ability to deal with stress goes down, and that's really important. And we're living in stressful times, so making sure you're also taking care of yourself as a parent is really important, and heeding some of the advice that Lauren talked about. So we're really glad that you guys joined us today. We will be coming back soon, hopefully by the end of the year, with our fourth installment with a to be determined topic. If you have any ideas and suggestions, feel free to post them on our social media websites at the Duke ADHD program or the Duke Center for Autism and Brain Development. Hang in there and get a good night's sleep. Thanks.